Welcome back. For this week's Real Men Wear Gowns, we are talking about sports medicine, the importance of staying active but doing it in a healthy way without being injured. So let's talk with Dr. Andrew Hill, sports medicine physician with Franciscan Health in Plainfield and Mooresville. Thanks for being here.
Thanks for having me.
So first off, let's talk about what exactly is sports medicine? How does it differ from traditional physical therapy, that type of thing?
Correct. So I would say sports medicine, like our main focus and kind of function is focusing on people's actual function and trying to optimize their movement patterns. And it can range from anyone, not only just, athletes on the baseball diamond or our runners. It can also be our older population trying to stay active, weekend warriors, play pickleball, or just do whatever their hobby is, whether it be crocheting or something simple like that. We're just trying to maximize function.
So what are some of the most common injuries you see?
Yeah, so for me, I like to kind of divide it into two kind of categories, acute versus chronic. So acute being more of that, sudden pull or that sudden, you rolled your ankle or something like that. Those most common injuries tend to be our sprains and our strains, sprains being our ligaments and strains being injuries to our muscles and our tendons. Now I'd say, in the office setting, we see more of our chronic injuries, and these tend to be like our tendinitises or overuse type injuries. But that's kind of how I kind of divide those into those two main categories there.
How important is it to stretch?
Yeah, I think for me, this is kind of a debatable topic because there's also like a timing associated with it. So I think before activities, there's actually some evidence that it's not as important to stretch. So we want more of our warm-ups to be more dynamic in nature where, we're getting our heart rate up, we're kind of warming up those muscles. But there's actually some evidence that, stretching cold muscles before activities can actually be a little bit detrimental to our overall performance. But, I do think it's important to maintain, flexibility and stretching, but it tends to be a lot better, after activities when our muscles are, already warm.
So, not to stereotype here, but a lot of guys, as we get older, if we're not regularly active, we've kind of fallen behind on exercise, may have a tendency to say, you know what, I'm getting back on it, I'm going to get back on the horse, or be that weekend warrior, I'm going to go hard.
Exactly.
What is your advice for people like that? How do you get back into it or get into physical activity if you've been inactive for a while?
I think the biggest thing there is to go slow. So I think, if you've been out for a long time, getting directly back into what you thought you were doing 10, 20 years ago does set you up for injury. So the biggest thing is you want to kind of progress back to those, activities in a gradual fashion. So, historically, if you were running 3-4 miles and, it's been multiple years since you've done that, start small. Start with, a half mile and kind of see how your body responds. Because, kind of going back too quickly definitely sets us up for, injury.
And along those same lines, how important is rest and recovery? How much activity is too much activity?
That's huge. That's where we kind of get at the whole like cross-training kind of mentality because we don't want to do the same things, over and over and over again because that can start to kind of wear down, on our body, make us predisposed to, injury, tendinitises, those sorts of things, So from a running standpoint, it's not just, running every day. You want to factor in, lower impact activities like cycling, maybe elliptical, things in a pool to kind of give those weight-bearing, joints and bones a break. And we also can't forget about, the strengthening kind of component, I think our society, we need to do a lot more, lifting and kind of building that, muscle.
Not just cardio.
Not just cardio, exactly. Because, if we look at our recommendations, we should average about 150 minutes a week in aerobic activity, but we've actually added, 2 days of weight training to those recommendations.
Why is that so important?
Because our muscles, protect our joints. If we don't have that muscle mass, then there's more, stress kind of going through our tendons and our joints. So our muscle is the way to protect these joints.
How do you know when to see a sports medicine doctor like you versus walking it off?
Right, exactly. I think it kind of going back to how we divide the injuries, it kind of depends. So, if it's more that acute injury, and you're having difficulty, walking or completing activities of daily living, you definitely should seek treatment. Now, if it's more on that chronic side of things, I think you can give it some time to kind of see how your body's responding. For me, I think a little soreness after activity is normal because that kind of stimulates that muscle kind of growth. But if it's lingering 24, 48 hours later, or, each week that passes, you're like, man, my shoulder's a little bit worse than what it was the week prior, that's definitely when you should probably seek treatment with either myself or another sports medicine physician.
Gotcha. Any final advice for staying active and healthy, especially over these summer months?
Yeah, so for me, I think the biggest thing is kind of get into that routine. You can't fake preparation. So for me, I think it's that consistency. It's like brushing your teeth, You should incorporate a little bit of it into your daily routine. And I think when you're kind of trying to get back into things all at once, that does kind of predispose you to injury. So just trying to maintain that, physical fitness from a week to week, standpoint. Don't try to make those New Year's resolutions and then kind of quit 3 months later.
Yeah.
I would say, just try to be as consistent as possible and find those hobbies that you love to do, because when you find enjoyment in those activities, that will keep you going.
All right. Dr. Andrew Hills, thank you so much for being here. Really appreciate it.
Yeah, thanks for having me.